Hi everyone. I'm Kate Casthrine Enad Aplacador. Excuse my look. I just came home from work. I'm here in Calgary, Canada, and I'm 31 years old. I graduated in Southwestern University, batch 2006. Yes, I took up my Bachelor of Science in Nursing in 2002, and I took up my nursing board June 2006. I passed, and since there was an issue on that examination, I retook it and then passed also. I am an OB nurse in CCMC, to name a few, because I am a clinical instructor in University of San Carlos. So what is your motivation? My motivation actually comes from my family. They actually give me they are my inspiration. They give me strength because our job is really not very easy, and so I just look up to them and get strength. And the third question is, throughout your nursing career, what was the most memorable thing you have experienced and why? Well, I guess my teaching career in nursing is really very memorable. I started at the age of 23. You actually touch lives, in a different way, although it's really not, although sometimes it's direct patient, but most of the time you teach students and you inspire them. You try to give informations in a way that's really very simple. And what was the worst? So, not really worst, but it's just the downside of it is when you have students that's older than you. So I have I have a student that's I think a doctor already who transferred nursing. So it was a bit harder because they actually have more information than you have, but it was not a hindrance. It's just what I did was, yeah, I just studied and make sure I was top of my game. Can you say that you were an effective nurse and why? Well, of course, yes. You make it a point every day that you make sure that you are very effective in one way or another, be it a student or your patient. You have to make sure that you give out all your efforts and everything, because it's so hard to wake up every day to go back to work when you think you are less effective in your job. Why did you stop working as a nurse? I stopped because the university I was teaching was actually going down, the number of students. So I didn't actually wait because I have bills to pay, I have family to feed, so I transferred to a new job. Next question is, if given the chance to be able to work as a nurse in an institution, would you take it or not? Absolutely yes. I would actually take it because I think this is my calling. Ever since I was not really young, but during the time high school, that's actually where you feel like asking yourself what you really want in life. So yes, I'd take it. Would you like to have anyone in the family to follow your footsteps as a nurse someday, and why? Definitely yes. You just have to inform. This is not an easy job. This is like saving lives, and the work schedule is different. You're sometimes on call. What you just have to do is just to inspire. You have to encourage. What can you say about the generation you were in versus the generation we have right now in relation to the nursing career? I think we're not really that much of a difference, but the only difference is the availability of the career you will have. As you can see, a lot of nursing students graduated not trying to be in the direction of the nursing career. So I think that's just it. Next and the last question, what can you give as a piece of advice to the current nursing students and everyone who will take up BS and in the coming years. Before you decide that you want to be in the nursing career, you just have to ask yourself, like everyone else, is this what you really want to be in the next few years or for the rest of your life? Then if you think that this is the career that's best for you, then go. You just have to make sure that this is what you love. You try to work on it. It may not be very easy, but sure, if you try to follow your heart, then you can absolutely do it. So there you go. Once again, I am Casthrine Enad Aplacador. I hope you guys be inspired. Continue to dream big. Okay? Thank you very much.